Patient is a 27-year-old white female. She presents with a complaint of a rash bilaterally on her feet and an earache to the right ear. Constitutional, she's negative for any chills, fever, fatigue, or weight change. Eyes are negative for blurred vision, eye pain, photophobia, ear, nose, and throat. She's positive for ear pain to the right ear. Patient says it feels clogged. Nasal, she's negative for nasal congestion. She does have frequent rhinorrhea and a sore throat, which kind of comes and goes. Cardiovascular, she's negative for any chest pain, palpitations, tachycardia, orthopnea, and edema. Respiratory, negative for any cough, shortness of breath. GI, she's negative for any abdominal pain, heartburn, constipation, diarrhea, or stool changes. GI, negative for, genital urinary, negative for genital vaginal lesions, hematuria, menstrual problems, polyuria, any abnormal vaginal bleeding or discharge. Integumentary, the patient has positive for rash bilaterally on her feet. And neurologically, the patient denies any dizziness, headaches, or weakness. Patient's vital signs: her temperature is 98.6, blood pressure is 128/76, pulse is 68, patient's oxygen on room air is 99%. The objective findings: the patient is awake, alert, and oriented, does not appear to be in any acute stress. Her skin is warm and dry. She does have noted rash bilaterally to the tops of her feet. Her head is normocephalic and does not appear to have any trauma. Her eyes, visual acuity is 20/20, and she does not wear any glasses. Her ears are, the external ear appears to be reddened, like the patient has been pulling on it. Her canal, I did not notice any discharge. The tympanic membrane is reddened and appears to be swollen. Her nose, the nasal mucosa is pink and moist. Patient's throat is pink and moist. The patient has poor dentition. Neck is supple without adenopathy. Trachea appears to be midline. The external chest is normal in appearance without lifts, heaves, or thrills. The patient's chest wall is symmetrical and without any obvious deformities and no signs of trauma. Patient's abdomen is soft, symmetric, and non-tender without any noted distension. I did not do a genital rectal for this. Her spine, neck, and back are without any deformities. Her extremities, the upper and lower extremities, do not appear to have any trauma. The patient is able to move her limbs freely. Neurologically, the patient's awake, alert, and oriented. She knows where she's at, time, and place. The patient has appropriate mood and affect. Moving on to the assessment. The working diagnosis for this patient is going to be ICD-10-R21, rash, and other nonspecific skin eruptions for the bilateral rash to her feet, and ICD-10-H92.03, otalgia to the right. Patient does appear to have a ear infection. For that, the plan of care For her rash and other nonspecific skin eruption, I ordered triamcinolone acetonide 0.1% topical cream. I let the patient know to apply a thin layer to the affected areas, which is both tops of the feet. But it would be topical route, and the patient should do that twice per day. Patient was educated on rash and how to keep the area clean. Otalgia, the patient, we did get bilateral earwax softening drops. The patient could put to her right ear, which is where she appears to have the ear infection. And I also ordered amoxicillin 875 milligrams by oral route. The patient should take one tablet, the 875 milligram, by mouth every 12 hours. I did educate the patient on use of antibiotics and that it can cause GI upset, and the patient may want to take the medication with food or yogurt to try to counter these symptoms. And I think that's it. Thank you.